Good morning, friends. Welcome to Bone Doctor. Today's topic is pain in the tailbone, or medically as we term it as coccydynia. That is pain in the coccyx. That is the last part of our spinal cord. Whenever we encounter, fall and injure our hips and the pelvis, it is the pointed end of our vertebra, that is the coccyx, which commonly gets injured. And due to that injury, there may be a fracture, or there may be a bruise, or there may be muscle injury around that coccyx. This is a cause of great pain and suffering in many patients who encounter such injuries. So today we are going to discuss how this happens, what is the ways we treat it, and how we diagnose such cases. So the most common cause of coccydynia or injury to the coccyx are as follows. You may have encounter a fall over your buttocks and you may injure the coccyx bone. Due to such injury, there may be bleeding around the coccyx. There may be pain and swelling around your anal canal. That is, you may have pain during passing your stools. There may be fracture of the coccyx due to such fall. For that, you may have pain during standing or walking or sitting for long periods. Such pains also occur in people or persons who have to remain seated for their professional reasons for long periods of time. For example, people who work in offices for 10 to 12 hours a day, sitting in a particular posture, have no time to stand up or move around, can experience such pain due to constant pressure in the coccyx. There may be also indirect injuries. That is, a patient or a person can slip and fall, and during the slip there may be a spasm or a cramp in the muscles around the coccyx, the muscles in the pelvic floor region. This may also cause such pains. Patients who have constipation, who have very hard stools, after passage of such hard stool may experience pain in their coccyx. During pregnancy, the bones become very weak, the ligaments become very soft. During this period, during the childbirth, the patients can experience pain in the coccyx. So these are the reasons for which a patient suffers from pain around the coccyx. So what are the symptoms of such problem? Patient experiences pain while he or she sits in a particular position for long hours. He may have pain during walking or standing, pain during any stressful work, pain during sit-ups or carrying heavy loads. This is due to weakness of the pelvic floor muscles. We know the pelvic floor muscles are attached to the coccyx. So coccyx, if it is injured or the muscles around it is sore, then any type of stress to the bone or the muscles will cause pain. So let us learn some simple ways or simple methods by which we can treat such pains in the coccyx. First of all, the first thing we should do is to avoid pressure around the coccyx. This can be done by sitting in an air ring. That is, the area around the coccyx, the area around the anus remains free from pressure. The pressure is of sitting, or the body weight falls upon the two buttocks, that is the ischial tuberosities. So the pain is reduced and the patient becomes pain-free very fast. Avoid sitting in hard surfaces for long periods of time. Take good amounts of calcium and other multiminerals, vitamins, which will help in relieving the pain and repairing the injury around the coccyx. Some ice pack or warm compress can be applied over the coccyx, which helps to reduce the pain. In some cases, physiotherapy in around the coccyx helps in reducing the pain. Persons who suffer from constipation should take stool softeners so that the hard stool doesn't irritate or provides pain to the coccyx. How we diagnose the cases of coccyx pain and how we differentially diagnose whether it is a tumor is there or any other mass is causing obstruction around the coccyx. First of all, we do an X-ray. An X-ray can show abnormal bending of the coccyx, fracture of the coccyx bone. If X-ray is not clear, we can go for CT scans to see for any other inflammation or periosteal reaction around the coccyx. We can do MRI and ultrasound of that area to get an idea of any tumorous lesion or any other growth in that area so as to rule out any tumors which is causing the pain. This is how we diagnose the other causes of coccydynia. In cases which are not responding to such conservative management of physiotherapy and medicines and rest and pillows, we give chordal injections, local steroid injection, anesthetic injections in and around the coccyx so as to reduce the pain. In cases where the pain is completely unbearable and not responding to any treatment, surgical treatment are provided in which coccyx is removed, partial or total, so as to give pain reduction in some patients. But surgery is the last option, and in many cases, surgery, even after surgery, the patient's pain may not be totally cured. So, we have to take steps to prevent such injuries to the coccyx, and if it at all occurs, we should take steps to treat it as fast as possible, because chronic coccyx pain doesn't cure very fast and it causes lifelong suffering in the patients. So how was the video? Please give a like and do comment your comments. If you like my channel, please subscribe to my channel. So that's all for now. Bye bye. Take care.